Hello, my name is Chris Parham, and this is my final project for Design is Experience. It's called Vestibular Vertigo, How to Use Symptoms of Vertigo to Create Experiences of Disgust. And in other words, what I'm going to be doing basically is talking about how the symptoms of vertigo, such as throwing up and vomiting and so on, those become experiences in disgust once you get vertigo. So my first slide is vestibular dysfunction is a disorder that affects your balance that makes you feel dizzy, nauseous, or off balance. Vertigo is a condition that causes dizziness and is often caused by an inner ear problem. And it makes someone feel they are spinning or moving when that person is actually standing still. I would like to show how symptoms of vertigo can lead to experiences in disgust. Common cause of vertigo, common causes of vertigo are caused by an inner ear problem. BPVV stands for benign paroxysmal positional vertigo, and the inner ear sends signals to the brain about head and body movements, and it helps you keep your balance. Meniere's disease is an inner ear disorder caused by a fluid buildup and changing pressure in the ear, and causes episodes of vertigo along with ringing in the ears and can create temporary hearing loss. Other forms and types of vertigo. Peripheral vertigo is triggered by physiological alterations in the inner ear that control balance, and central vertigo is triggered by neurological disorders in the brain. Psychogenic vertigo is caused by psychological factors such as anxiety or depression. Main differences, for instance, between vestibular neuritis and labyrinthis is that vestibular neuritis refers to inflammation of your ear only, while labyrinthis refers to both the vestibular nerve and your cochlear nerve. And the three most known kinds of vertigo, as I said earlier, BPVV, which stands for benign paroxysmal positional vertigo; labyrinthis, a viral infection of the inner ear that can cause dizziness; Meniere's disease, which is caused by a buildup of fluid in the inner ear and can cause temporary hearing loss. BPV happens when calcium carbonate crystals known as otoconia are embedded in the inner ear, but if they become dislodged and move into the semicircular canals of the ear, they cause the fluid to move and it leads to dizziness and vertigo. Here we are going to discuss how the symptoms from vertigo create an experience of disgust by how these symptoms lead to vomiting, diarrhea, slips and falls, migraine headaches, fast eye movement, feeling nauseated, spinning, and feelings of complete unbalance. So vestibular neuritis is an infection of the vestibular nerve, with the nerve sitting in the inner ear and detects balance by sending signals from the inner ear to the brain, which can then bring on a symptom of nausea. So nausea in this case becomes an experience in disgust. Meniere's disease, and I repeat the reason I'm repeating this, as I said earlier, is that like I said, because it's a disease of inner ear disorder affecting hearing and balance, and is believed to be caused by too much fluid building up in the inner ears and can lead to slips and falls. The reason I mention this again, and the same thing with the other ones as well, is that I'm trying to relate it to real life experiences in terms of how people get sick, how you kind of equate slips and falls with a disgusting situation, just as you would vomit or diarrhea. So in this case, I'm doing the same thing here. And that's the only reason why I'm repeating it, because I'm putting it into the context of what's so disgusting about this specific thing or this disease. So again, slips and falls become an experience in disgust. And the same thing with this one as well, where Meniere's disease can cause rapid eye movements with a patient's eye basically operating on their own with constant uncontrollable movement as a result of this form of vertigo. And it is called nystagmus, and it may affect your vision and balance. So nystagmus becomes an experience in disgust. Acetaldehyde is a toxin produced with candida, basic yeast infection, which is the most common form of fungal infection. But when the liver becomes oversaturated, it gets released into the bloodstream, creating feelings of brain fog, intoxication, and vertigo, loss of equilibrium, and loss of balance. So as you can see to the left-hand side, the right-hand side, excuse me, as you can see the tongue there looks really nasty. So candida becomes an experience in disgust. So, And also, motion sickness is related to vertigo and is due to the difference between actual and expected motion. And your inner ears control your sense of balance. Your sense of balance and parts of the vestibular system include the utricle, which detects horizontal motion, and saku detects vertical motion. So in this case, motion sickness becomes an experience in disgust. And of course, diarrhea is also a symptom of vertigo, and it can make people who have vertigo very dehydrated and thirsty and prone to more vertigo attacks. But vertigo does not cause diarrhea, as the vestibular system affects the digestive system. So, of course, in this case, diarrhea becomes an experience in disgust. And the other kind of vertigo is central vertigo, which is triggered by neurological disorders in the brain, such as a traumatic brain injury, stroke, or infection in the brain. And symptoms include headaches, spinning sensations or motion, dizziness, weakness, trouble swallowing, and nystagmus. So dizziness in this case, along with lightheadedness, becomes an experience in disgust because you can hurt yourself. You can fall and hurt yourself if you're dizzy, and so on. So that's one of the reasons why I included that as a experience in disgust. And psychogenic vertigo is caused by psychological factors such as anxiety or depression, obsessive compulsive disorder, panic attacks, hyperventilation, lightheadedness, agoraphobia, and dizziness. So in this case, panic attacks become an experience in disgust, along with lightheadedness and anything that could make you actually hurt yourself because you have vertigo, hurting yourself, getting hit by a car or something along those lines. So that's really important. And these are my references. But what I'd like to do to finish up my presentation, I would like to show a couple of short videos that deal specifically with what I'm talking about. So we're going to just go back up to, we'll take a look at our slides.
Unexplained chronic dizziness has long puzzled doctors, but a new study sheds light on the possible causes of the condition. Both neurological problems, such as migraines, and psychiatric problems, such as anxiety, may play roles, but it's often not an either/or situation, says Jeffrey Stab, MD, researcher for the study and the attending psychiatrist at the Barron's Center at the University of Pennsylvania in Philadelphia. In some cases, it is definitely neurologic or psychiatric, Stab says, but more often than not, when someone has chronic dizziness, you have both a neurologic and psychiatric contribution that works in each other in a vicious cycle. Stab focused on a type of chronic dizziness not related to vertigo, the feeling of having usually linked with inner ear problems. Among these forms of dizziness, he says, is one type that is particularly mysterious. He focused on this type, which has been called psychogenic dizziness, and is associated with anxiety. He prefers to call it chronic subjective dizziness. Patients who have it feel dizzy, off-kilter, imbalanced, and are very sensitive to motion stimuli, such as crowded environments or heavy traffic, Stab tells WBMD. The best way to understand this form is to shake your head back and forth 20 times, he says. When you are done, that is the feeling these people feel, he notes. When these patients enter an environment filled with visual stimuli, such as having out of the rain or navigate through a busy grocery store, the dizziness gets worse. Too much sensation is coming into the brain, Stab says of the condition, which can be disabling. About 3% to 5% of American adults have recurrent bouts of dizziness, Stab says. About 1% have persistent dizziness. In his study, Stab and his co-author, Michael J. Ruckenstein,
And that's the end of my presentation. Thank you very much. I appreciate it. Thank you.